I chose to do my presentation over Osteogenesis Imperfecta. After this presentation, you will be able to understand what Osteogenesis Imperfecta is, all the different types of Osteogenesis Imperfecta are and how they're different, and how some of them are the same. And lastly, how to treat Osteogenesis Imperfecta, because for us in our profession, that is so important. Okay, just to kind of give you a rundown of what it actually is, osteogenesis imperfecta, or OI, is also an inherited genetic bone disorder that's present at childbirth. A lot of people know it as the brittle bone disease. This can lead to children fracturing multiple of their bones because they are so soft. So when kids are born, sometimes a ton of their bones are broken. So birth is extremely painful for them. This can also lead to bones not forming normally. So bowing of the legs. If you look up a picture of children with osteogenesis imperfecta, you will see that their bones are not formed normally. There are at least 8 different types of this disease, and it is based on x-ray findings, imaging testing, and genetics. The side effects can also range from mild to severe, obviously depending on what type you have. How does osteogenesis imperfecta develop? It is caused by a defect in or related to a protein called type 1 collagen. Collagen is a very important building block of the body to make bones strong. Strong tendons, ligaments, teeth, and the whites of the eyes. So if you think about it, if you don't have collagen, your body's just going to have less structure, it's going to have less strength, it's just not going to be as strong. Since there's a defect in the collagen, these patients do not have a strong, structured body, like I just said. This is why their bones are fragile and brittle. For example, a slap on the arm may hurt for a healthy individual, but for OI, that could fracture their arm. So this also leads to a ton of apprehension with movement for all these children. So they have to be very careful with all of their activities. Again, that all goes into what type they have. What types of osteogenesis imperfecta? So I'm going to be going through all the types. It's kind of lengthy, but I think it's really important that everyone knows what the differences are, because some of them are very severe and some of them are mild. So type 1 is the most common form of OI. 50% of children with OI have this form, and it's also the mildest form, so that's good. Bones are likely to break from mild to moderate trauma, while they have most of their broken bones before puberty. Loose joints and muscle weakness. They have mild to no bone deformity, so meaning most of their bones are formed normally, but some of them aren't. They have normal collagen structure, but less than normal amount is produced. So they're just a little bit less strong, but it's not formed abnormally. And then curved spine with potential for compression of the vertebrae. That can increase the risk of fractures in the vertebrae. They have triangular face and blue, purple, or gray tint to the sclera, and possible changes to strength and color of the teeth. Again, teeth have a ton of collagen in them, so this is definitely affected deeply. And then type 2, this is the absolute most severe case of OI. Death is caused shortly at or after birth because they can't breathe. Also, going into that, they have underdeveloped lungs, severe bone deformities. So with type 1, it wouldn't be as severe. And then they have improperly formed collagen, so it's not just a decrease in the amount, it's actually formed improperly. And multiple broken bones develop before birth while the baby is still in the womb. And they have a very small stature. And then type 3, this is the most severe type of OI of people who do survive. Type 2, they're not surviving, they're dying before or after birth, but these type 3 people, they're not dying, and this is the most severe type. They also have very fragile bones that break easily. Broken bones normally present at birth. They have moderate to severe bone deformity. They have difficulty breathing and swallowing. They have curved spine and compression of collapse of the vertebrae. Again, they have the improperly formed collagen, and their lung problems like difficulty breathing and such like that. It definitely worsens with age. And again, they also have problems with their teeth. A lot of the types, they do have problems with their teeth just because collagen is so involved. And then type 4, bones break easily, but most break before puberty. They have mild bone deformity, barrel-shaped rib cage, improperly formed collagen, triangular face, possible hearing loss, and again, they have possible strength and color changes of the teeth. Type 5, the symptoms are clinically like type 4, and then they also have a dense band seen on x-rays by the cartilage growth plate of the long bones. I thought that was interesting. And then changes in mineralization of the bone. They have calcification of the membrane between the radius and the ulna, which results in restricted arm movement. They have possible loose joints. It's common to have hypertrophic calluses, which is like enlarged, like thickened areas where the bones are fractured at. And this type has no changes to the teeth. Type 6, this is very rare, and the symptoms are like medium. It resembles type 4 in appearance and symptoms. This type is not always diagnosed at birth, and the symptoms actually progress over time. I thought this was really interesting. They have a fish scale appearance to bone when viewed under a microscope, which is just weird to think about. And then they have a curved spine, and then again, changes in mineralization of the bone, which makes the bones more brittle and prone to fractures because they don't have all that nutrient to the bone that normal people do have. And then type 7, it resembles type 2 and 3 in appearance and symptoms, has a small stature, short humerus and short femur, possible smaller head size, changes in process of forming collagen, common to have shorter than normal height, which is assumed since they do have a shorter femur. So if they have a shorter leg, then they're probably going to be shorter. And then type 8 resembles type 2 and 3 in appearance and symptoms. They have very soft bones and severe growth problems. They have a rounded face, and they may experience hearing loss also. So a really important thing that I think to remember that we learned is to practice, good patient and family education and practice safe positioning. One thing that is critical with these patients is education, obviously. This is so important because this is something that the children are born with, and the parents need to know how to take care of their child. If your child's born with osteogenesis imperfecta and you just take them home, you don't really know what you're doing. It's hard to just be a first-time parent in general, but when you have all these extra things that you have to think about, like you don't think about being careful when you pick your child up, you don't think about how you lay them down, like all of these things have to be taken into consideration, and no one knows. Like, no one would know how to do that without actually taking the time and learning deeply about how to do it. Practice positioning, just so that there's less compressive forces on the child's body, and ensuring that their child is doing activities within their limits once they're older. Once the child's old enough to know, we're not just educating the mom and dad anymore, we're including the child, because we want him to be as independent as possible as soon as possible. And then again, their positioning should be changed throughout the day, just so there's not so many compressive forces at one spot all day. And then avoiding infection is also very pertinent for these patients because it could affect their other body systems. Their structure of their body is already depleted a little bit, and we don't want to take away anything else. Like, for example, someone with type 3 OI already has trouble breathing and swallowing. So, like, if they're getting COVID or any respiratory infection, that's going to be pretty debilitating for them. They're going to have a hard time recovering from that. So yeah. How do you treat these patients? Obviously, the main goal of the treatment is to prevent deformities and fractures. Once your child gets older, to allow him or her to function independently as possible. This is important because, when they grow up, they're going to have to do stuff by themselves. So we want them to be independent as possible. And that's what most kids do. So we want them to feel as normal as possible. Biphosphonate medicines to help strengthen bones and prevent fractures. Obviously, we're not prescribing the medicine, but just to be aware of medicines that these patients will be on, most likely. Care of fractures, practice safe positioning and handling. Again, we already talked about this. And then refer the patient to occupational therapy. This is important. I think the whole healthcare team needs to take a group approach to treating this patient because, he doesn't only need physical therapy, he needs occupational therapy. He also needs, he might need to go to counseling just to process the disease and how to handle those hard social situations and all that. Bracing, splinting, and using assistive devices. This is also really important because, where we come in is we're showing them how they're using it. We're showing them why this would benefit them. And we're also educating the parents on, if they need to adjust the walker or something, we're showing them how to do that. And then also surgery. Surgery can help realign the patient's body to make it more stable. They could put metal rods in there just to help out the patient. I think this slide is one of the most important slides I have, how to approach physical therapy, because it's not just like any other patient. One thing to keep in mind during treatment is that these patients do not tend to have neurological issues such as impaired coordination, sensation, or cognition. I feel like sometimes when, someone comes in and they're like, oh, I have this disease, I have this, and you're automatically like, oh, their cognition probably isn't all the way there, or they might not be able to feel their feet. That's not the case with this patient. They're all the way there, their bones are just brittle. So, the thing that we have to be careful about, these patients are very apprehensive to movements because they're afraid they're going to fracture anything. So, running for us, they can't run. So this is where the treatment becomes tricky because, they're all the way there, but they're scared because they've fractured so many bones before. It is also important to establish safe movement patterns, encourage self-confidence, and optimize strength. All of these are going to progress the patient to being individual as possible. And I think that's the most important goal that we could do because we want these people to have a good quality of life. We want them to be able to socialize the best that they can. Yeah. Okay, and then physical therapy treatment, exercise, including weight-bearing activities. We want to do this because we want to simulate those stabilizing muscles, and it's good for bone health when we do weight-bearing activities. This also may include braces of assistive devices. And then aquatic therapy, it's such a good low-impact exercise. I actually linked a YouTube video at the end of a patient that's on TikTok. He's TikTok famous and Instagram famous for sharing his journey with osteogenesis imperfecta, and it's a video of him doing aquatic therapy. Walking is so good because he can't walk on land, so walking in water is the next best option. And then gait training and functional education on movement patterns to help avoid injuries and fractures. Again, it's super important to establish these safe movement patterns so they're not as apprehensive when they're walking, and so that they know that they have something safe that they can go back to move themselves around. Range of motion exercises to maintain their motion and prevent contractures. This is super important. Strengthen exercises. So even though these patients have brittle bone disease, we still want to do strengthening exercises because we want to build their muscles. They still have to have strength. Now we obviously can't do high intense stuff, but we still want to build a lot of strength in these patients because they need it. And then postural education in exercises. Again, we want these patients to have good posture. It's going to help all around. What is the quality of life for these type of patients? Honestly, if the proper care is taken, the quality of life of patients is pretty good. It also depends on the severity. So like someone with type 3 is not going to have the same quality of life as someone with type 1. So that is a big factor. Also, it depends on their access to healthcare. If you don't have access to healthcare, you can't go to therapy. You can't get a wheelchair. It's so much harder for you to take steps to help this disease. And you also need a good support system at home. It's hard. It's a mentally challenging disease. You feel like you're missing out. You can't do things that everyone else does. So all of those are really needed. And then overall, individuals have different experiences with this disease. It's very situational. And then this is my last slide. This is Kevin G. He's become famous for sharing his journey living with osteogenesis imperfecta. We do not specifically know what type he has. His parents never really released that information, but he really is an inspiration all around the world for people with OI. He documents his whole life. He documents how he travels. He documents what he eats. He documents him in therapy. And he also documents the harder sides of the disease, like how many surgeries he's had, how making friends is hard for him, and all of that. And he actually just now worked up to being able to stand with a walker. He can't take any steps yet, but he's able to stand, and that's a huge, huge accomplishment for him. Also, I have a YouTube video linked below of him in aquatic therapy. So if you want to check that out, you can. But that is all I have for today. I hope you know a little bit more about osteogenesis imperfecta. And if you have any questions or comments, you can feel free to message me on Teams. And then I also have a sources page if you want to look at any of the websites that I used.